Welcome to the DeFabio Difference for Health Management. I'm Jill Lally, and with me in the studio is Dr. Donald DeFabio, dual board-certified chiropractic orthopedist and sports injury management. He is the local chiropractic team doctor for 2 universities and owner of DeFabio Spine and Sports Rehab, Chiropractic, Acupuncture, Nutrition. Welcome, Dr. DeFabio.
Well, thank you for having me here, Jill. I'm really looking forward to being on your show. Thanks.
Dr. DeFabio, you are a natural healthcare provider.
Yeah. Mm-hmm.
Drugless, non-surgery is your approach.
Yeah.
In this today's society, we have a huge opioid crisis. That's an epidemic. And I'd like you to take a moment, if you would, to really explain it and what we can do for it with natural pain solutions.
Well, big question, Jill. There is a lot you can do to manage pain without drugs. However, opioids are a class of drugs related to morphine, opium, heroin, and they work really well at controlling pain. They really do. And that's kind of where the opioid crisis that we're going through started, because these drugs are very good for pain control, so it just made sense to make more of them. What do I mean? Oxycontin is an opioid. Fentanyl's an opioid. Methadone's an opioid. Tylenol 3 with codeine, that's an opioid. So yeah, they work well for pain control, so we ended up using a lot of them, and it led to problems because when you're taking these drugs, they work so well. I mean, opium was outlawed in what, the turn of the 1900s, because of all the Chinese workers on the railroads were addicted to it. All right, they're very addictive, and if you can continue to get your opioid drugs, you're addicted to prescription drugs. But if you can't get your prescription anymore, then you have to go to street drugs. Then you do go to heroin, okay? And then you do go to crack and other things, and that's a problem. In fact, since 1999 to 2015, there have been 500,000 deaths related to opioid type drugs, prescription and non-prescription. 500,000 deaths in America since 1999, 2015 is when the data came in. So that's a lot of people. It's 91 people a day right now. In 2016, 91 people a day in the United States die from prescription drug overdose. 60% of those are opioids. Over 63% are opioids.
So the reason for taking the drug is pain control, and then there's a pathway to addiction that keeps the patient wanting more.
I guess I could have said that way. But you said something very astute, is that the drugs are to treat pain. And unfortunately, I don't know exactly when, but doctors were instructed to treat pain like a vital sign, like your heart rate, like your blood pressure, like your temperature. You know, if your temperature goes too high, it could kill you, right? If a baby's temperature goes too high, you got to get it down. Or if your temperature goes too low, it'll kill you. So pain all of a sudden became a vital sign. When you're in the hospital, they ask you to do a visual analog scale. They ask you to look at this scale and say, you know, where are you on this scale? Where's your pain? Is it a 2? Is it a 5? And they treated pain. Again, morphine, codeine, Percocet, really good at treating pain. Opioids, so they use those, then people get hooked, and then it leads to other problems.
So is it readily available now that it's becoming
the problem was several-fold. Like we said, treating pain as a vital sign was one problem. The next problem was pharma. Okay, OxyContin wasn't even developed until 1991, 92. 0 sales. Sales quadrupled by 2000. right? Then they quadrupled again from 2000 to 2015. We analyzed the amount of pain Americans were reporting from 2000 to 2015. That didn't change, but the amount of opioids prescribed quadrupled. Treating pain is a problem. Let's face it, our society, when you go to your medical doctor, you expect him to give you something. Doctor, I hurt. You expect him to give them something. The doctor's like, well, I got to treat pain, so I'll give you something for your pain. But they weren't giving you 2 or 3. They were giving you a 1-month supply, a 2-month supply. Originally, it was designed for short-term use. Currently, you can still get them. It's a lot harder, but for very short-term use for very specific things. By the way, research has shown for back pain, the use of opioid is not significantly better than a non-steroidal anti-inflammatory for the treatment of back pain. So I got news for you. Treating back pain, musculoskeletal aches and pains was normal using an opioid, and that was really an inappropriate use of it.
So are they treating acute pain, chronic pain, both? Is there?
Well, yes. There's 2 types of pain. Acute pain is related to some sort of injury, some sort of insult on the body. You sprain your ankle, you throw your back out, you get an infection, all right? Aches and pains of cold and flu. But then there's chronic pain, which is more of a disease process. That's pain that lasts more than 3 months. That has to be managed. Acute pain resolves once the injury or the disease situation resolves. Chronic pain lingers and persists, and that needs to be managed. And there's lots of ways to manage chronic pain besides opioids and besides pharmaceuticals. That's what I do every day as a natural health care provider.
Well, your commitment to your patients and the DeFabio difference with integrative approach leads you to offer them solutions to prescription pain.
Well, well, not only do we have solutions, but that's what chiropractic is. Chiropractic is drugless healthcare. By training, I'm a chiropractic doctor. What does that mean? It means lifestyle changes. It means using ice maybe, okay? It means eating the right foods. Jill, do you know that certain foods will drive inflammation, will create inflammation in your body, and certain foods will suppress inflammation in your body? We know that. And that's based on human biochemistry. It's not based on your blood type, your hair color, your skin type, or if your mother was facing north when you were born. We know that certain foods, high in omega-6 fatty acids, will increase inflammation. We know that every time you eat, your blood sugar goes up. How high your blood sugar goes up, how fast your blood sugar goes up determines how much inflammation that meal created. And what is I'm asking you, Jill, what does inflammation do to your body?
Creates pain.
There you go. And if you were to Google just about any disease and put inflammation and the disease, I bet you'll find a research article that says they're related. Chronic inflammation's been related to high blood pressure. It's been related to osteoporosis. It's been related to cancer. It's been related to cholesterol problems. All right? Anything that's got an itis or an osis in its name is an inflammation. Neuritis, inflammation. Arthritis, inflammation of the joints. Diverticulosis, inflammation of the gut. Gastritis, inflammation of the stomach. It's all inflammation.
So you address the inflammation primarily with your patients as their first step, naturally? Looking at their diet?
Well, a majority of my patients do come to the office because they have pain.
Okay.
If I feel their pain is related to a systemic inflammation, yeah, we have that discussion on would benefit you to change your diet and your lifestyle. And eating right and exercising, taking nutritional supplements, getting enough sleep. Those are all things that are going to help your body heal. And some people want to heal it, some people don't. But like I said, certain foods drive inflammation, but certain foods suppress inflammation. You can stop the pain by eating certain foods. You can stop the inflammation by eating certain foods, all right? And that's what people have to understand. So every time you eat, every time you have something to drink, you can manipulate your inflammation levels, all right? So if I was drinking green tea, water's good. Green tea is anti-inflammatory. Ginger's tea is anti-inflammatory. Green things are anti-inflammatory. Vegetation, plankton, seaweed. China, I'm not saying China, Japan, they eat lots of seaweed, right? A lot less heart disease. Interesting, all right? Less inflammation, right? And meat is anti-inflammatory if the meat is fed greens. So grass-fed meat is anti-inflammatory, all right? Grains are pro-inflammatory. Grains drive inflammation. So if you're eating meat that was fed grains, USDA, grass-fed beef, it's going to drive inflammation because it's full of chemicals called arachidonic acid. So these are all the variables of diet. So yeah, food is a drug. And not everyone wants to hear that. But it is something we do talk about in the office. And if you have chronic pain, that's a decision you have to think about making.
Well, Dr. DeFabio, you've given us so much information on diet. Perhaps we can take a short break and discuss natural pain management beyond the opioids with what you said, the supplements, the exercise, the lifestyle changes when we come back from our break.
Oh, that'd be great, Jill. I'd love to do that, and I do it every day in my office, so hopefully I can empower your viewers with some information.
Thank you, Doctor. We'll be right back.
It's a huge problem today. Opiate addiction, prescription medication addiction to prescriptions like Vicodin, OxyContin, Percocet. Those are highly addictive opiates. They're actually morphine derivatives. So much so that 1.9 million Americans are addicted to those prescription drugs. Just today, a patient came to the office with sciatica, showed me her prescription from her medical doctor for OxyContin. This is so much of an issue with the opiate misuse and abuse that March 2016, the CDC, the Centers for Disease Control, and the U.S. Agency for Health and Human Services issued a policy statement that doctors need to consider non-pharmacological alternatives and non-addictive medications for people with musculoskeletal pain. Chiropractic care has solid research that shows it's effective for low back pain, both acute and chronic. There's solid chiropractic research that it's beneficial for neck pain and headaches. Check the Duke University study. Chiropractic has been proven to be non-pharmacologic and safe treatment for musculoskeletal complaints. That's what I do as a chiropractic doctor. So if you suffer with musculoskeletal pain, go to the chiropractic doctor first. The research is there, satisfaction results studies are high, and it just might be what the doctor ordered. Of my people come in because they have pain, because they can't do something. They can't go to work, they can't play sports, they can't take care of their kids. There's something they can't do. They come in, we give them a short series of visits, and they get back to their everyday activities. I call it returning back to function.
After I had my first baby and couldn't move my head and my neck was really stiff, and one of the fitness instructors at the Y, whose class I took, came here and she really loved it here. I've been coming ever since.
When I came to Dr. DeFabio, one of the things he was able to do was to take the time to understand my problem, explain to me what was actually happening with the body, and together we developed a plan to find success in the treatment. So I was able to really gain a quality of life back that I wasn't sure that I could ever have again.
There's a whole aspect of chiropractic that's about health and wellness and a lifestyle. That's a lifestyle choice. Those are the people that choose to commit for periodic adjustments to help maintain the quality of their life and to stay active.
I made a commitment to myself to take care of myself because it makes me a better mom and a better wife, and it makes every part of my life better. It's not really about, coming in with an injury or something to fix. It's more about taking care of yourself from head to toe, thinking about what you eat and thinking about how you exercise and how you stretch and how it all plays into feeling good.
There's 5 factors to a wellness lifestyle: getting enough sleep, exercise, a healthy mental attitude, eating the right foods, the appropriate diet, and perhaps nutritional supplements, and a healthy nervous system. And you have 2 choices. You can choose to embrace it and do everything you can to enhance it, or you can choose to do nothing. So incorporating those 5 factors of health will create a wellness lifestyle.
Welcome back to the DeFabio Difference for Health Management. I'm Jill Lally, and with me in the studio is Dr. Donald DeFabio. We've been discussing the opioid crisis, and Dr. DeFabio is going to now tell us beyond the opioids, natural pain management solutions. Dr. DeFabio?
Well, there's a lot we can do naturally. We talked a little bit before. Starts with eating right, okay? And by the way, Jill, all healthy diets are the same, okay? But an anti-inflammatory diet is shifting your body away from what's called the inflammatory cascade. And there's several different protocols to do it, but the bottom line is if you stop the pro-inflammatory foods for 2 weeks, just 2 weeks, and you increase your anti-inflammatory foods and take anti-inflammatory supplements that are natural and safe, you'll know if your problem, whatever your symptoms are related to inflammation. So for example, we mentioned greens and vegetation's anti-inflammatory. One of your best sources of that is an omega-3 fatty acid supplement, okay? Something that has fish oils in them. Now, caveat about fish oils. Fish oils need to be purified. You don't want any heavy metals, lead, or PCPs in them, okay? They need to be fresh. Oils get rancid, all right? People get those fish burps. That's usually because they're old, okay? And there needs to be a high enough concentration of the active ingredients called EPA and DHA in there to become effective. If you take a lower concentration of fish oil, it's great for your brain health. It's great for your cholesterol profile. It's great for your overall systemic well-being and inflammation. However, if you want to shut down that inflammation like you would an opioid or Tylenol or Advil or something, then you got to take enough of active ingredients to be effective, okay? Other good anti-inflammatories. Curcumin is an extract of turmeric. We found that curcumin, when it's made bioavailable, means it's changed a little bit from just eating turmeric, okay, will shut down the inflammatory cascade. 350 milligrams a couple of times a day. Marivia is a good standardized bioavailable curcumin. BM95 is another one. So you want to get a standardized, high quality curcumin. Those are great for acute inflammation. And you can also do them ongoing, all right? So, hey, guess what? Aspirin comes from the tree of the white willow tree, the bark of the white willow tree. White willow bark is natural aspirin. So there's lots of things we can do. Disc problems, an inflamed disc or herniated disc. There's research that's shown that that's related to chronic low-grade inflammation. That's why just bending over to pick something up makes your disc go out. All right, so you got to shut down the inflammation, and then you can take extracts of pineapple and papaya, which are really good for acute inflammation. Those need to be taken on an empty stomach, okay, by the way. And then with some chondroitin and some glucosamine, you know, you can get products that are great for healing of the disc, okay? And it's got anti-inflammatory things, and like the extracts of ginger and turmeric and curcumin and things like that, as well as healing properties. So as a natural doctor, my job is to figure out what your problem is. Is it acute? Is it chronic pain? What your diet's like? And what are we going to do to put out the fire? So yeah, there's lots of options. There's lots of options.
Are these products available in your office?
Yeah, we have them in the office. And
if patients or viewers had questions, would they be able to contact you?
The bottom line is I'm all over the place. Yes, they can contact me. They can call me in my office in Berkeley Heights, 908-771-0220. My website, DeFabioChiropractic.com. And if they really want to learn a lot of stuff, I recommend they go to my YouTube channel. Go to YouTube and put in Dr. DeFabio, and you can put in inflammation. You can put in foods that stop the pain. You can see one of my exercise videos. Yeah, I have over, I think, 4.5 million views on my YouTube channel. So there's a lot of really good information there for people. You know, but one thing I say on my YouTube channel I think is important for people to understand is that it's important to be informed. It's important to take charge of your health. However, it is also important to work with somebody that knows what's going to be best for you. These supplements are great, but the most expensive supplement is the one you don't need. Right. My exercises I show in my videos are great for lower back pain, except for the one that's the 5 worst exercises for your lower back. Don't do those. But what ones do you need? Just because they're great exercises doesn't mean it's for you. And that's what I do. So it's okay to consult with your doc. And if your doc isn't aware of the exercises or the supplements and the nutrition, that's okay. Everybody can't know everything. Right. Find somebody who does. Only 25% of the American population who takes supplements discusses it with their healthcare provider.
So you become more like the health coach for them. If someone wants to train in their journey of health.
That's an excellent analogy. I think that's really good. And yeah, we do talk about things like get enough rest. You don't get enough rest, your body doesn't heal. I learned that 29 years ago when I was first in practice. You know, that a patient wasn't getting enough sleep, and I saw how her condition deteriorated, and I was like, wow, sleep's important, rest is important. You know, yeah. Well, that's the benefit of being in practice.
Well, you know, doctor, you spoke about diet, which someone can do for themselves. They can take supplements, they can do some of your exercises, but really to complete an integrative approach for pain control and healing, would they benefit from coming to your office for chiropractic or acupuncture or exercise rehab?
All of those things are part of a natural approach to healthcare. Yes, acupuncture works great for pain management. It's been around for thousands of years. You know, exercise is really important. Balancing flexibility, strength, and endurance is really essential. If a joint doesn't move properly, it's going to create friction. It's going to get inflamed. It's going to create pain. Arthritis, very interesting situation, arthritis. If you use it too much, it gets inflamed and sore. You don't use it enough, it gets stiff and sore. You got to keep the joint moving. By keeping it moving, it helps maintain mobility and decreases pain. And there's some excellent research on how a chiropractic adjustment actually slows down the percentage of pain impulses that get to the brain. And that might be a little bit much to talk about, but for our viewers who are technical, a chiropractic adjustment creates presynaptic inhibition in the spinal cord at lamina 7 of the internuncial neuron pool. We got research. I don't want to talk about it today, but that's the bottom line.
Thank you.
And you know, also, you got to be happy. You know, your thoughts drive what you do as well. So from a natural perspective, yeah, you got to take charge of your health. And that's from your brain to your nerves to your organs to your muscles. It's motion, it's creating strength, it's creating flexibility. But that's my job, is figuring out what you need. And sometimes patients don't need what we have in the office, and my job is to refer them to the specialist that does have that, you know. But pain's no fun, and you want to manage the pain, and you want to get out of pain yesterday. So you do whatever you can, and you know, and sometimes that involves, you know, topical liniments too. Arnica works very well. It's a topical natural gel, you know. Yeah, BioFreeze, hand me that for you, please, Jill. BioFreeze, you can get it at Walgreens, you can get it at CVS, it's all over. Great stuff for pain control. I like this because it sprays on, goes on hands-free. However, it also has a professional strength BioFreeze, okay? All right, which is a little bit stronger, which you can only get from docs. So there's options out there, but it really begins with the question you have to ask yourself. How do you want to manage your health? How do you want to manage your situation? Do you want to just take something? Look, I know I'm a diabetic. I'll just take my insulin and eat whatever I want. Or, you know, I'm a diabetic. Maybe I should stop eating carbohydrates and exercise more and take some cinnamon and some palladium and some chromium. All right? How do you want to treat your problem? When it comes to pain, yeah, we want to address the pain, but maybe we want to address the cause. See, in chiropractic, we look for the cause of your problem. All right? Is it joint? Is it muscle? Is it nerve? Is there an inflammatory process going on? Is it the way you sit? Is it the way you drive? Is it the way you sleep? Do you need a jobectomy? Right? What's driving the inflammation, which is driving the pain? So does everybody need a full life makeover? No. But sometimes a short episode of an anti-inflammatory diet, ramping up some high-quality omega-3s, getting on a good herbal supplement or magnesium for 2 to 4 weeks will change somebody's life.
Thank you, Dr. DeFabio. It's been a pleasure listening to you with your amazing amount of information and your willingness to give hope to those viewers and patients that they can manage their chronic pain. And I look forward to hearing more. And if you would like to contact Dr. DeFabio, 908-771-0220 for DeFabio Spine and Sports Rehab, Chiropractic, Acupuncture, Nutrition. I'm Jill Lally with the DeFabio Difference for Health Management. Thank you.